Welcome, everybody. We'll just wait just a couple minutes here, and then we'll get started today's webinar. All righty, go ahead and get started here. Welcome and thank you for joining us today for the Walk Cares Conversation webinar. Today we'll be covering transportation and mobility as you age. My name is Logan Sargent, and I am the Walk Cares Fund Outreach and Language Access Lead, and I'll be hosting today's presentation. Let's take a moment just to meet our panel for today. Katie, we'll start with you.
Everybody, my name is Katie Ricciuto. I use she, her pronouns, and I am the policy director for Transportation Choices Coalition. We're a statewide advocacy organization that works to fund and support more public transit across the state. And I'll talk a little bit more about that later.
Thank you, Katie. Delana.
Hi, I'm Delana Combs. I'm the Ombudsman and Accessibility Officer with Spokane Transit Authority over on the east side in Spokane. And I'll be talking about transportation options in the Spokane region.
All right, Firon.
Good morning, everyone. Perone Latch. I use he, him pronouns with Sound Generation's Transportation Director. And I will be, excuse me, and I'll be talking about aging and transportation.
Awesome. Thank you, everybody. Walk Cares team will be answering questions today in the Q&A function during the presentation. We'll be joining us later for the Q&A portion of the webinar. Anyone who has joined us on a computer or using the Zoom app on their phones can submit questions through the Q&A function at any point in time in the presentation. If we are unable to answer your question during the allotted time, please email us with your question. This webinar will be recorded. The recording along with the slides will be available on our website, wallcaresfund.wa.gov/webinars within 24 hours of the completion of the presentation. We'll start this presentation off by talking about why a program like the Walk Cares Fund is needed. Sebastian, next slide. A program like the Walk Cares Fund is needed because the way that we've been paying for long-term care up until now simply is just not working. Even though 70% of us will need long-term care at some point in our lives, most of us can't afford it. Cost for just 20 hours of home care per week, just over $23,000 for 6 months. And other types of long-term care are even more expensive. The cost of 20 hours of home care per week, but the median household income for Washington State seniors is around $69,000 per year. Family caregivers really have to step in to fill that financial gap, either with their own savings or providing unpaid care. Almost half reported a related financial setback, and they spend on average around 26% of their own income on care-related expenses. A public insurance program like the Walk Cares Fund gives workers a more affordable way to pay for the long-term care needs by allowing them to contribute while they're working and their income is higher. Then they can access money to pay for the care that they need later on in life and when they're on a fixed income. Covering all workers also helps keep contributions low, and once they retire, their contributions will stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people need access to care. Unlike private insurance, which typically requires you to pay out of pocket for 90 days before you can access benefits, Walk Cares has no deductible or waiting period. Next slide. To earn WellCare's benefits, most Washington workers automatically contribute 0.58% of every paycheck during their working years. You only contribute while you're working. Everyone is covered the same low rate regardless of pre-existing conditions. Starting in May of 2026, you'll be able to apply for benefits, and you'll need to meet a contribution requirement and a care needs requirement. Once approved, you can get to choose how you would like to utilize your benefits. Full benefit amount starts at $36,500 and will grow over a period of time with inflation. You can use your benefits for any covered services and supports that you want. There's no out-of-pocket costs when you need care. We pay providers directly for their services. You receive no copay or no deductibles. Next slide. This is what contributions look like over the course of a typical career. A typical workers participating in WellCares earns around $59,000 a year. They pay $29 in contributions per month, which adds up to over $10,000 total when paying into the fund over a 30-year career. To earn less in benefits than you contribute, you'd have to make on average around $210,000 each year for 30 years. Next slide. Everyone who has contributed to the WellCares Fund more than 500 hours per calendar year is earning benefits. This includes part-time, temporary workers as well. To qualify for benefits, you have to meet the contribution requirements through one of these three pathways. First pathway is what we call the permanent pathway. This will earn lifetime access to the full benefit amount by contributing for at least 10 years into the fund. The next is what we call the temporary pathway. You'll earn access to the full benefit amount if you contribute to the fund for at least 3 of the last 6 years at the time that you apply for benefits. This is designed for people who have contributed recently at the point when they need care but haven't earned permanent access yet. And in 2026, applicants who contribute for 3 years at any point in the program can qualify through one of these pathways. The next is what we call the transition pathway. This will earn you permanent access to 10% of the full benefit amount for each year that you contribute. So if you're born before 1968, this will apply to you. So for example, if you contribute to the fund for 2 years, you'd earn 20% of that benefit amount, or roughly around $7,300. This is designed for people near retirement at program launch who might not be able to earn permanent access to the full benefit amount. And these workers can also earn full benefit amount if they qualify through another pathway as well. Next slide. To use your benefits, you must determine that you need help with at least 3 or more activities of daily living and will continue to need help for at least 90 days. The activities we consider are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. We'll count any activities that need supervision to complete, like someone monitoring you or reminding you to start or keep going with the activity or helping you set up. Next slide. When you're ready to apply for benefits, you'll start by creating an online account. If you need help managing your account, you can set up an authorized user, like a loved one or representative. You can also get help with your application from your local area on aging, or call us to apply over the phone. Once you submit your application, we'll confirm that you've met the contribution requirement. Then you'll be able to schedule an appointment to talk about your care needs. And after we've met with you, we'll let you know how, if you're approved, to start utilizing your benefits. Next slide. Once you've been approved, you can apply. You can use your benefits for any covered services and supports from a WellCares provider. You may want to choose services to help you stay safely in your own home, like in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support family caregivers. You can get paid care from a loved one, even your spouse, or you can get respite care so they can take a break. We cover education and consultation, help them manage your care as well. Dementia, behavioral supports, and care transition coordination to support you when you leave a facility like the hospital. You can also choose to receive services in your own community, like an adult family home or adult day services. Or you can choose to receive care in an assisted living facility or nursing home. And this even includes memory care. Next slide. We also have a section here on transportation. You can book a ride with a registered provider or ride with a loved one. And these are both options that may be covered. Each month, you can also spend up to $412 using your Walk Cares Fund benefits. Total mileage cannot exceed 260 miles per month. There will be mileage reimbursement. So if you ride with a loved one and request mileage, you can request a mileage reimbursement using our financial management services vendor. There's other ways to pay as well. You can book transportation with a registered provider and use your benefits to pay for those services. You can purchase a bus pass, ferry ticket, taxi script, and more, and request reimbursement using our financial management services vendor as well. Next slide. Starting in July, you can choose to continue participating in the Wild Cares Fund even if you do leave the state. To become an out-of-state participant, you must contribute to the fund for at least 3 years, where you work that minimum requirement 500 hours or more per year. You must opt in within a year of leaving the state of Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. We are also working on a process for out-of-state participants to report their earnings and pay premiums with a focus on making it as easy as possible for those individuals. Starting in July of 2030, out-of-state participants will also be able to access benefits outside the state of Washington. Next slide. Here are some key milestones around the program launched this year. In January, we began a pilot program in a few counties to test out our process. As April 1st, workers and recent retirees will also have contributed and can create an online account to check annual contribution statements and eventually apply for benefits. On May 18th, applications and benefits were open statewide. And July 1st of this year, all beneficiaries can start receiving services. And Katie, I'll pass it over to you now.
Wonderful. Thank you so much. Happy to be here today. As I said, my name is Katie. I work for Transportation Choices Coalition, and I'm here to kind of give a high-level overview about transportation and mobility and how it affects people with disabilities and seniors across our state. Next slide. Just a little bit of background about Transportation Choices Coalition in case you don't know who we are. We are a policy and advocacy nonprofit dedicated to making transportation accessible to everybody in Washington state. We pass policies that support more and safer transit, biking, and pedestrian travel at all levels in the state of Washington. And we also run funding campaigns to fund transit agencies and our transportation system across the state of Washington. Next slide. As I said, these are kind of the ways that we work. In addition to our policy and funding work that we do in Olympia, we also have partnerships with agencies across the state that are providing transportation to individuals. And we do education and outreach. For example, we host events for transit riders and policymakers to bring people together. And we run public campaigns like the annual Ride Transit Month, which is actually happening right now in June. And then finally, as I said, we run ballot initiative campaigns to fund transit agencies. Next slide. We have been around for 34 years. We're a staff of 9. We like to say we're a staff of 9 for a state of millions and millions. So we're really proud to be able to do the work that we do. Our office is based in Seattle, but again, we travel all across the state to do our work and have partnerships with agencies and organizations across the state. Next slide. So we, as an organization, are not necessarily the experts in, disability or senior rights and mobility conversations, but we like to work at the intersection of how transportation affects people. So I'm going to just give kind of this broad overview and then turn it over to people who work with these populations every day. So just to kind of get everybody on the same page. As many of us know, many older adults and people with disabilities don't drive, whether by choice or by necessity. We can say that people won't drive because driving has become too risky or stressful or no longer feels safe, even if somebody still has a valid driver's license. And that means that if somebody is aging in place or living with a disability, they're often staying at home more and have community, or and if they're in a community that's built around cars, they will have to deal with like living in an area with that's car dependent long after driving feels safe or realistic for them. And then there's also people who cannot drive, whether that's because of a disability or health condition or anything that makes them feel unsafe or that driving is physically impossible. Um, and then for this group, transit in particular isn't a backup plan. It's really the primary way that they stay engaged in their community. Next slide. These are just some statistics. 1 in 5, so 20% of Washingtonians will be 65 or older by 2030. The baby boomer generation is a large generation and is getting older. So almost 20% of our population will be of retirement age, more or less, in the next handful of years. Um, and the population of people over 65 is actually projected to double from what it is now to over 2 million by 2050. And then when asked, 75% of adults over the age of 50 have said that they want to stay in their current home as they age. So this kind of tells us that people are going to need to find ways to move around their communities. And, they won't be necessarily living in assisted living facilities as they age or as they deal with their disability. They will want to be in the place that makes them feel comfortable. So we need to be able to design services that serve them where they are. Next slide. There's a lot of risks of driving to people as they age. 25, uh, 20 over 740 or more people are injured in traffic crashes every day in the US. So um, crash death rates per mile traveled begin climbing in people's early 70s and are highest for drivers 85 plus. So finding ways that people can get out of cars and still get around is really important. In addition, seniors typically outlive their ability to drive safely by almost a decade. And so that's nearly a decade where people need another reliable way to get around. And then this is not just for seniors, but for everybody. The cost of owning a car in the state of Washington is almost $12,000 on average. That can equal out to almost $1,000 a month. And we know gas prices are going up. So giving people an alternative to owning a car as they age, or if they are not able to fund the cost of that car or work to earn money to do that is really important too. Next slide. So we like to say missed rides can equal missed care. 3.6 million Americans miss or delay medical care every year because they lack reliable transportation. And this falls very highly on certain groups of people. So older adults with no remaining household drivers. So older adults that live alone or live with people who don't drive, people with disabilities that prevent them from driving, low income households with no vehicle access, and then rural residents that live very far from clinics and pharmacies and can't get there in a reliable manner. Next slide. So I just want to, before I turn it over to people who can talk more deeply about this, I just kind of wanted to give you a quick guide to like the types of transit service and the types of fares that people need to think about when they're thinking about how to get around. So the types of bus service generally that are offered throughout the state of Washington are fixed route bus service and light rail, particularly in the Puget Sound region. But fixed route is really like, you look at the bus that has a certain number, like the Route 49, and it operates on a fixed route and it comes at a fixed time throughout the day. This is the most common and usually the lowest cost option for most trips. And then there's ADA paratransit service. These are a shared ride, door-to-door van service for people whose disability prevents them from using fixed route buses or trains. There's also van pool, dial-a-ride, and community shuttles. These often operate in smaller, more local or rural areas, and they fill gaps where fixed route service just doesn't reach because it's not financially feasible to operate fixed route service. And then there's also things that we can think of in terms of like ferries and regional connections, like intercity bus service that is typically, takes longer, maybe a little bit more difficult to access, but still makes up a really important part of Washington's transit network. Next slide. And then these are just like the type of fares that you'll typically see on transit. So there's usually a full fare, which is a standard adult fare. It depends on the agency that's operating what that is. There's regional reduced fare permits. And so these are for riders 65 and older or people with disabilities or Medicare card holders. Usually they're like a flat fare of $1 or something like that on regional transit. But again, this is like regional transit agencies operate. Orca Lyft, this is Puget Sound focused, anybody who's operating off of the Orca card program. It's an income-based reduced fare, about 50% off for qualifying adults up to 65, because over 65, there are different programs that typically come in. And again, like you have to go through the process of qualifying for this, but it's a way to reduce fares significantly for people who need it. Free or subsidized annual passes. These are available in some counties for people that are already enrolled in certain state benefit programs. And they are administered by local transit agencies. And then I just want to call out that transit under the age of 19 is free statewide for young people. So if you are a young person or taking care of a young person living with disabilities, they should be able to ride the bus for free if they are under the age of 19. And then there's paratransit fares set by the transit agency and usually similar to the regular adult fare. But again, this is like a regionally or locally administered fare. Next slide. So as you're thinking about, the Washington Cares program and the people who are supported by that program, and if you are a caretaker or working with caretaker, I just want to call out some of the policies that make transit and transportation options available to people who need them. There's the Americans with Disabilities Act. I think a lot of people have heard of. This was established federally in 1990, and it trickles down to the way that transit agencies operate, but it requires them to run accessible vehicles and provide paratransit service for people who can't use fixed route transit because of a disability. And then that kind of translates to like federal funding to support that. And that is through the Federal Transit Administration. And that helps fund ADA accessible transit, but also there are other programs that fund vehicles and management and operating costs for transportation that serve seniors and people with disabilities. There's special programs for transit in rural and small urban areas, as well as large urban areas like Seattle or Spokane or Vancouver. There's state funding. WashDOT has a paratransit and special needs grant. There's hundreds of millions of dollars available from the state to fund these things. And a lot of it specifically sustains and expands transportation for seniors, people with disabilities, rural communities, and tribal communities. Next slide. Just a few more policies that support more transit. As I said, Move Ahead Washington was like this big state transportation funding package that passed a few years ago. It committed billions of dollars over 16 years to fund public transit. This is what free transit for young people, or youth ride free, as we call it. It also creates investment in paratransit and special needs service. There are reduced fare policies across the state that local transit agencies operate, as I've already talked about. These are meant to remove the cost as a barrier to riding. And then we're here today talking about the Washington Cares Fund. So we already heard about that, but that's like a really exciting new intersection of funding at the state level that isn't necessarily directly for transportation, but translates into getting people where they need to go through funding their transportation needs. Next slide. That's it from me. Feel free to reach out to me if you have any questions. My contact information is on this slide, and thank you for having me today.
Okay. My video started. Hello, everyone. I am Delana Combs. I'm the Ombudsman and Accessibility Officer for Spokane Transit over in Spokane on the east side. Next slide, please. I'm going to talk about some. We're going to do the next slide. Thanks. So I'm going to cover our main forms of transportation that we have here in Spokane. And a lot of them are similar to other properties across the state. So some of the things that Katie covered, I will be going into a little bit more detail with some of the features of those vehicles. So fixed route, that is the main form of public transportation. Most people just call it the bus or the city bus, but it is actually, the industry term is fixed route because it's on a route that is fixed and it doesn't change very often, maybe a few times a year. So there's a lot of accessibility features for older folks or people with disabilities to continue to be able to have their independence and transportation to be able to participate in life. So things like buses kneel in, I can't think of any major transportation property in the state that does not have kneeling buses anymore. So that is a big misconception that from a long time ago that people would have to go up steps to get onto the main floor of buses, and you don't have to do that anymore. So they kneel, they're low floors, and then we have ramps that deploy to curbs or sidewalks. So when that all happens, it's really flush with the curb, and people that use like power chairs or wheelchairs can get on the buses. People that use walkers don't have to step up on anything, and they can get in onto the buses. There's also wheelchair securement areas on all of the buses. All of ours have at least two. On the west side, there's a lot of buses that have, or other vehicles that have more than two, but there's at least two on most buses. So people that use wheelchairs can ride fixed route as well. We also have automatic stop notifications. That's an ADA requirement. So for major intersections, things like major intersections where we intersect with other routes, major like landmarks, the operators have to call them out, or a lot of transportation agencies have automatic stop notifications. And those help people stay oriented to where they are. Someone who might have just a hard time knowing their directions, someone that might be new to the area, someone that has maybe a cognitive impairment or a visual impairment. So it's good to keep them oriented as to where they are on the bus. Also, operators are required to provide assistance. This is an ADA federal requirement for all passengers. So things like boarding and lighting the bus. If someone says, say they're using a manual wheelchair, if they can't get on, if there's not a curb, because there's not always going to be a sidewalk when the bus is kneeled and the ramp is deployed, it can get kind of steep, especially if you're in a manual wheelchair. And so operators are required to get up out of their seats and help someone get on and off the bus in a situation like that. And then there's things, more assistance, like if they need to know which stop to get off on, the operator will tell them, and help paying the fare, things like that. So there's a lot of assistance from the operators too. Next slide. All the buses also have priority seating, so that's usually up in the front. And on our buses in Spokane, it's the same spots as the wheelchair securement areas you can see in this picture. So that is for people with disabilities and seniors. They can sit there, so it's directly in front of the bus, directly behind the operator. And then those spots stay clear for the people that need them, usually, if other passengers will accept that. And then we do have to sometimes ask people to get up out of those priority seating for someone that uses a wheelchair to be secured in there. Personal care attendants, the PCAs, those can be used. That is a paratransit, and I'll talk a little bit more about paratransit in the next couple slides. That's a paratransit requirement. You have to be eligible for paratransit to be able to have a personal care attendant, but they can ride free with someone who rides paratransit or the fixed route if they're eligible for paratransit. And that is somebody that helps someone before, during, or after their trip on the bus or on the van. Upon request, operation notify you of a stop. I said that last slide. And then all of our wheelchairs are secured, and we have lap belts and shoulder straps as well. Next slide. So here are our reduced fare programs for fixed route only. We do not have reduced fare for paratransit. So we have an honored rider that is for ages 60 and older or individuals with disabilities. Stars and Stripes, veterans and active duty, and then Opportunity. This is a pilot program, and we just started it about 7 months ago, and we were doing it for 2 years to see how it goes. So it's a low income half price fare, and all of these are half prices. So instead of $2 for a 2-hour pass, it's $1, and then we do capping here. So you'll never pay more than, if you are on a reduced fare, $2 a day on a fixed route. So you can take 9 trips if you want, and you're never going to pay more than $2 in that day. And then we have $30 monthly capping. So you can take as many trips, and you'll never pay more than that $30 a month. But you also are paying as you go. So next slide. Service animals, we have service animals on all of our vehicles on fixed route and on paratransit. And the definition of a service animal for Department of Transportation is any animal that is trained to perform a specific task related to the person's disability. So this is where it differs from like DOJ's, Department of Justice's definition, which is a horse or a miniature horse or a dog. And Department of Justice accepts emotional support animals. DOT does not define an emotional support animal as a service animal. So it's only an animal that is trained specifically to perform a task. So you can see in this picture, we used to have a service pig. He no longer rides, but I still like that picture. Just some quick facts for people about service animals. They're not required to have a special license, like a service animal license, or wear a vest. It is always helpful when they are identifiable, but it's not a requirement. They don't have to have proof. There's no special like certification that they have to go through to be a service animal, because lots of people can train their animals to do things on their own. I can't train my dogs, but other people I've heard can train animals. Animals must always be under the control of the handler. So that is a big one. There are sometimes people that might say that a dog is a service animal or an animal is a service animal, but they're barking or they're not under their control. So we will exclude certain animals from our services and from our properties if they are not under the control of a handler, if they're barking aggressively, things like that. There's no breed restrictions, so any dog, like pit bulls, we get questioned about. There's no breed restrictions allowed. And then no customer with a service animal will be asked to leave due to another person's phobia or allergies. A service animal is required for a person to be able to participate in life. So we want to make sure that they can do that and this is shared public transportation. So if someone is not comfortable with dogs or certain animals, then they're more than welcome to get onto a different vehicle for that. Next slide, please. Okay, now I'm going to jump into paratransit. So the technical term is ADA complementary paratransit, which is our shared door-to-door van service for people with disabilities. So fixed route's the primary form of transportation, but paratransit comes in as the safety net for people who can't ride the regular bus all of the time or some of the time due to the effects of their disability. So it's not age related. Some properties across the state, ooh, my slides went away. Is that just me or there we go? Some properties across the state I know combine their age-related door-to-door service with the ADA paratransit. So depending on where you live, that age might be a qualifying factor. Here in Spokane, age is not a qualifying factor because that's not technically the ADA eligibility requirements. So what we look at, you have to apply to be paratransit eligible. That is a requirement from the ADA. And you're found eligible if you can't get to or from a bus stop, on or off the bus, or navigate the system independently all of the time or some of the time. So, and then there's different levels of service also. So somebody say that uses a power chair. If it's a beautiful day like it is today, they can get from their home to their bus stop just fine. But if there's 3 feet of snow on the ground, it might be a little difficult, so they might want to take paratransit. Or someone with a visual impairment, they get to and from work on the bus, the regular bus, they know how to do that 5 days a week, but they're going to go to Walmart on Sprague here, and the bus stop's on Sprague, and you have to walk all the way through this big open parking lot, which is really difficult to do sometimes with some people if they are using a white cane. So they might want to take paratransit to make sure that they are safer. It is door to door. Here in Spokane, we do escort people from their door to the van and from the van to the door. Some agencies only do curb to curb service, which can still make it hard for some people to access paratransit because they can't get from their door to the van by themselves. So we like to go to the door and we escort everyone 100% of the time. The fare for this is a full price fare for as it is the same on the bus. So it's $2 a trip, $4 daily cap, and then a $60 monthly cap. And we can go next slide. So just some quick facts about paratransit. So the technical term, like I said, is complimentary. That's with an E, not an I. So it doesn't mean it's free. It means it's complements fixed route. So whatever fixed route does, paratransit has to do. So it runs the same days, same hours as fixed route. It's the same service area as it's based on fixed route, and paratransit will go 3/4 of a mile as the crow flies from where fixed route goes. We can't deny any trips. We can't prioritize any trips. People can go to the casino, to the bar, to the church, to friend's house, to school, with all the same prioritizations. There is a 30-minute pickup window. I like to just remind people of that. That's an ADA requirement that, not a requirement, but it's allowed under the ADA. So people have to schedule a ride on paratransit, and if they say it's scheduled for 9 a.m., then they're still considered on time if they get picked up between 9 and 9:30. That's because paratransit, there's no fixed routes. The drivers are trying to figure out their own ways to get to people's houses and to grocery stores and to jobs and doctor's offices. And there might be an accident or construction or closed roads. And then because in paratransit, it's dealing with a more vulnerable population, things can happen that don't necessarily happen, we can't plan for, like falls, lifts not working by chance, things like that. So we are allowed a little bit more of a window there. So that's just always important to remember. And then paratransit still does not allow violent, seriously disruptive, or illegal behavior. So it's still not the right form of transportation for some people, because it is still shared public transportation. So if somebody has a tendency to be violent because of the effects of their disability, then paratransit still might not be the right form. They might be eligible, but it might not be the right form of transportation for them. Next slide. This is our service area here in Spokane. It's important. You can see you can't really zoom in and see where the edges are. If you live in Spokane, or if you know of somebody that's using paratransit in Spokane, it's really important to remind people to call and check if they're moving, check their addresses. Makes sense that we don't go, way the heck up north because it's way up there. But there's a lot of places because the regular bus doesn't go that paratransit won't go, and there's zero wiggle room. We do plot by plot, so a neighbor can be in and your house can be out. We can still transport them, but we just can't pick them up from their home. So they'd have to get into the service area. And there's a lot of places that aren't really out in the middle of nowhere that, because fixed route doesn't go there, paratransit won't go there either. So I just like to remind people of that. Next slide. This is something that is coming soon. I think we're supposed to be launching it in September. So mobility on demand. Because there are those zones that are not out in the middle of nowhere, but they are fixed route doesn't serve them. We will be having, it's kind of I think we're doing a pilot for the first couple of years, or slowly bringing on different zones to bring people in from those zones into the main service area, or transporting people within those zones. So if they're in the Latah Valley area and they want to go somewhere into the Latah Valley area, they can do that. Or if they want to go from Latah Valley to, say, Sacred Heart, then they will be transported to the nearest bus stop within the service area, and then they can ride the bus to Sacred Heart. Next slide, and I'm running out of time, so I'm going to go. This is my last one. Rideshare. This is our other form of transportation. It is for commuters. It might not be applicable to people that are aging, but I always like to just remind people that it's an option. We used to call it van pool. It's kind of like carpool. And if people have 3 or more folks that live and work in the slightly same areas, then they can get a vehicle. It's really inexpensive. Everything is covered by us: fares, roadside assistance, fuel, maintenance, insurance, snow tires, car washes, all of that. And so that is a really great option for people that have to travel more than we usually say 10 miles to work is when it becomes nice and more cost efficient. Next slide. That is it. Thank you.
Great, thank you. Yes, next if you're on.
All right. Yeah. Good morning, everyone. Again, my name is Perone. I serve as the transportation director at Sound Generations. So I'm gonna just briefly go over the services Sound Generations offers for transportation, but also just kind of the effect of transportation and the barriers that we encounter as we age. So Sound Generations currently operates 2 programs. We have our Hide Shuttle and our volunteer transportation services. So for our Hide Shuttle, we offer demand response, door-to-door service. Our shuttles are driven by paid employees, and the rides are free, but donations are accepted. So with High Shuttle, all of our buses are ADA accessible. We all have lifts, power lifts to get mobility equipment on and off the bus. So yeah, we can support, from power wheelchairs to walkers, and anything else that may assist you in your mobility. It is a neighborhood shuttle, which means we operate usually within the city limits of where you live. So we just operate mostly or primarily in King County. So for instance, if you live in the city of Renton, you can only get picked up from your home in Renton and travel anywhere within Renton. We can't take you from Renton to Kent or from Renton to Seattle. So that's more reserved for volunteer transportation, which I'll cover later. So together, these programs help older adults and individuals with disabilities access medical appointments, grocery stores, senior centers, meal programs, pharmacies, and other essential destinations. With High Shuttle, again, there's no restriction on where you can go. So a lot of people go sometimes to the park, or they go visit friends, medical, dental appointments, grocery shopping. Hyde will do that, for you. For volunteer transportation, the rides are are done by our volunteer drivers in their personal vehicles, and it's not going to be able to transport mobility equipment. So if you have a wheelchair, or if you need assistance getting in and out of a vehicle, volunteer transportation will probably not work in your case. Again, the volunteers aren't supposed to assist you getting in and out of the vehicle. They are just meant to take you from your house to your appointment, your medical appointment. So for Hyde Shuttle, the qualifications are you just have to be 55 years old and older, or an adult with a disability. So 18 and older, as long as you identify with the disability. Again, the rides are free, and we encourage the request to be made 3 days in advance and up to 30 days. That's kind of the sweet spot. We do accept same day requests, but those are very unlikely to get approved just due to our demand right now. And with volunteer transportation, the requirement is you're 60 and older, and live within King County. So we just serve residents in King County. So while transportation is often viewed as simply getting from point A to point B, for many older adults, transportation is key to maintaining independence, health, and social connection. And just feedback from our riders and just kind of the work we do. Transportation is healthcare. So one of the biggest misconceptions about aging is that healthcare begins when someone enters a doctor's office. But in reality, healthcare begins when a person can get to their appointment. Many older adults eventually stop driving due to vision changes, mobility limitations, cognitive decline, medication side effects, or simply feeling unsafe on the road. So unfortunately, transportation options don't always increase when driving ends. So without reliable transportation, older adults may miss medical appointments, delay preventative care, skip trips to the pharmacy, experience food insecurity, and become increasingly isolated. Transportation is often one of the social detriments of health that receives the least attention, yet it affects nearly every aspect of healthy aging. So how does transportation support independence? One of the most common things we hear from our riders is, I don't want to be a burden. Many older adults want to remain independent for as long as possible, and transportation plays a critical role in making that possible. When someone has access to transportation, they can manage their own appointments, grocery shop independently, attend community activities, visit friends and family, remain active and engaged, and transportation helps preserve dignity, autonomy, and quality of life. So how does this support caregivers? Transportation challenges don't only affect older adults and people with disabilities, they also affect family caregivers. Many adult children balance careers, children, and caregiving responsibilities. Transportation is often one of the most time-consuming caregiving tasks. Reliable transportation services can reduce caregiver stress while ensuring loved ones continue to receive needed services and remain connected to their communities. So what is Sound Generation doing? So through Hyde Shuttle and volunteer transportation services, Sound Generation has helped fill transportation gaps across King County. Again, our programs provide door-to-door transportation, volunteer driver services, accessible transportation options, transportation for medical and essential trips, and community-based transportation that helps older adults age in place. Every day we see how transportation helps people remain independent longer and stay connected to the services and relationships that matter most. Again, our services at Sound Generations are free. Through state and local and federal funding, we are able to offer the service free of charge. But again, donations are more than welcome. So in closing, as we think about aging, caregiving, and long-term care planning, transportation should be part of the conversation. A person may have excellent healthcare, housing, and community services available to them, but if they cannot get there, those resources become difficult or impossible to access. Transportation is not just about mobility, it's about independence, health, dignity, and connection. So I'm not only a transportation professional, I'm also a family caregiver for an adult son with disabilities. So transportation isn't theoretical for my family. Reliable transportation is often the difference between participation and isolation. So thank you for the opportunity to be here today and talk to you all.
Yeah, thank you so much, Firon. Alrighty, so now we'll begin our Q&A portion. As a reminder, please submit your questions through the Q&A function located at the bottom of your screen. If we do not have time today to answer all your questions, we're running out of time here, you can email us through our website as well. So if you want, go ahead and utilize the Q&A function. We'll answer any kind of questions that you might have. We'll wait just. Go
Sorry, I
ahead, Sam.
have some people who are messaging me questions. So there's one question that says, they have a family member with disabilities. Do they need to ride with them on the different transportation options, or are these people, or is their son allowed to ride by himself?
Uh, I guess I can answer for some generations. It all depends if the individual with disabilities does not need primary caregiver or can get on and off and to the destination safely without anyone, they can definitely ride on their own. But if they do require a family member or a caregiver, when the ride request is made, they just have to let us know so we can accommodate two individuals. But for the most part, they're able to ride solo. But if they have, if they're unable to communicate or if they require physical assistance, then a caregiver or a family member is likely to be needed.
It's important to remember that the drivers, operators are not medical professionals. So if they're strictly there to drive and to assist in getting people to their destination. So like he said, if there's need for that, it depends on the case. Also for us, children under 6 cannot ride by themselves. So that's on paratransit and on fixed route. But other than that, people with disabilities can ride. One that comes up often is if someone has a seizure disorder, or a medical emergency on the vehicles, we will be calling 911. They won't provide first aid in most cases.
Great. And then I think we already answered this, but is same-day transportation available, or how much notice, like, can you get an on-demand ride? And also, can I schedule it out if I already know a date and time that I need a ride?
In Spokane for paratransit, you can schedule it up to 7 days in advance, and as recent as the day before. It's not 24 hours; it's the day before. So I could call today at 5:40 or 4:45. Our call center closes at 5, and request a ride for tomorrow morning. The more notice you give, the better. We don't do same day. That is not a requirement for the ADA. We can do it if we have the availability. So we might have better chances with that with the mobility on demand that we're launching. But I do know that it's important to ask the location that you're at. Some do same day rides, but most do not.
Yeah, we accept requests same day, but again, very rarely does that work out. As Delana said, probably the day before would be the shortest of notice to possibly get on. We recommend 3 days notice, and you can schedule up to 30 days in advance if you know your schedule.
Great. Sorry, I'm just looking through these questions. We answered a bunch of these. Let's check here. Um, Either Logan or Sebastian, can you explain the difference between WalkCares and Medicare and some information there?
Yeah, so Walker's Fund covers anything within the, long-term care umbrella. What separates it from Medicare is the individual does not have to liquefy their assets down to $2,000 like Medicare long-term care insurance.
Great. And then I think we have some questions about our vehicles wheelchair accessible. I think we already had some slides on that. And then, as a reminder, all these slides and the contact information for the panelists that are in the slides will be available on our website after today's webinar. In the interest of time, I'm going to go ahead and move on to the next slide. If you do have a question, like we said earlier, that we didn't get to, or you want to ask us a question, you can email us directly and we can put you in contact with any of the panelists, or we can send you an answer back directly. As soon as you exit out of today's webinar, there will be a survey that'll appear on your screen, and we would love to hear your thoughts about how today's presentation went. If you could take a few minutes to complete that survey. Next slide. Again, all of today's webinars materials will be available on our website. We have social media, Facebook, Instagram, and LinkedIn, where you can find information about the Walk Harris Fund and other upcoming webinars. We do have our next webinar is going to be a Walk Harris Basics webinar on July 8th, and that will cover everything that you need to know about walk errors and benefits, and we'll go into some more detail on that. I will drop the registration link in the chat if you are interested in registering for that. Otherwise, you can contact us at the contact information listed on your screen. And we appreciate everybody's time today and hope to see you in a future webinar. Thank you.